So in this section, I want to talk about the differences between a stroke on the right side versus the left side, and how the presentation of your patient will be different depending upon where that insult to the brain occurs. So with the right-sided CVA, you can think about this whole system, and if depends upon how significant that damage is, the blockage or the bleed that occurs on that part of the brain will determine what happens on the opposite extremity, so the opposite side of where the insult occurs. So the characteristics of a right CVA presented on the left side would include weakness on that left side, decreased attention span. So this is informative when you're deciding how much time to spend with that patient. If they have a limited therapeutic window to work with them of like 5-10 minutes, you may consider breaking up your session into smaller chunks. Or if you can, split up your treatment if you're in an acute setting or a subacute setting such as a skilled nursing facility. Hemianopsia is a field cut, and you'll know that you have a field cut. Could be a character. It does not mean all these characteristics will occur, for example, in a right CVA. Some of them, could be a few of them, depend upon the severity of the stroke, the amount of time that brain did not have relief from the stroke, such as the clot-busting drugs that are now available that need to be administered within a specific period of time. If there's successive microstrokes and then one part of the brain, you could see several of these characteristics. Emotionally labile, that's just not having the filter that we have which prevents us from saying things that are inappropriate or potentially upsetting to other people. Impulsivity, that could involve not locking the wheelchair brakes or standing up even though it's unsafe. And with the left side, you have CVA. You have the right-sided weakness, decreased left and right discrimination in terms of extremity use and determining, what side is their weak side. And this is involving the patient being unable to determine that. What's the left side of the treatment table versus the right side, the left side of their overbed table versus the right side. Difficulty swallowing, which is what dysphagia is. Speech therapy is involved with helping these individuals, but it's important as a PTA to recognize what dysphagia is. So if we're seeing a patient laying supine and trying to swallow and choking, and they have dysphagia, to respond immediately to prevent an adverse medical event such as choking or potentially pneumonia if fluid is getting into the lungs. Increased frustration, or decreased frustration tolerance, so less ability to problem solve when frustrated. Imagine, when your amygdala is going off in your brain and you're really upset. Imagine that going and continuing and not toning down, like someone cuts you off in traffic. Imagine, you're feeling that frustration and that keeps going versus the ability to say, okay, let's problem solve this. The car's already passed. I can take a breath, and I'm not going to chase him down the highway. And then apraxia is purposeful movement. That includes brushing teeth, combing hair, and that inability to get that comb to the spot that you want to comb hair, for example. Inability to prevent functional or purposeful speech can be a problem with individuals with a stroke, with the right side involved, and compulsive behavior.